Well, welcome, welcome, welcome. So I'm going to give a little bit about myself to start, and then I'm going to introduce Jolene, who's the other individual that's on this wonderful presentation today, so that we can tell you guys a little bit of our own personal journey and what it is that we do within the healthcare organization and system. So again, I'm Shantae Moorhead. I'm a practice manager with Pacific Medical Center. And this picture most represents me because I have a team of very diverse, happy people that I work with every single day. I am a leader, but I'm also a person that helps collaborate and work with my team to make sure that we are able to deliver the best care that we can for our patients and for each other. So the main thing I always let people know, being a supervisor and a manager is something that we do to help people grow. We're mentors. So we help some of our staff get into different aspects of healthcare if they're interested. And we also encourage them and coach them to get into education if they're trying to go back to school or learn a trade skill or anything like this. So as you can see, there's a lot of happy people here at Pacific Medical Centers by my picture. Our managers and supervisors are the ones that actually work and inspire these employees in their day-to-day operations. So it's not the CEO. So the CEO doesn't normally impact what we do at our clinic levels. It's normally the managers and supervisors. My journey into healthcare started a little bit differently. I did not originally want to be in healthcare. I did not search for that. I actually used to work in a university in the cafeteria. And I loved working at that university because I was around students that were young and fun and engaging. And that's where I thought I wanted to be. And then one day, a friend of mine said, "Hey, you should come check out Pacific Medical Centers and work at our front office." And so that was over 18 years ago. And now I'm here 18 years later, still enjoying my job every day, working with fabulous people, collaborating on how I can help serve my patients every single day. I did not see myself here that long at that age, so long ago. But over the time, I've decided that, this is where I see myself as a career. And I've gone back to school in order to obtain degrees so I can be a better leader for my team and also help our company be better with our patient care and what we do to serve others. And so that is my own personal healthcare journey into healthcare and why I'm here now at 18 years later and enjoying myself. And then I'm going to introduce Jolene Rodriguez, and she'll tell you a little bit about herself too and her journey.
Hi, my name is Jolene Rodriguez. I'm actually a dual role employee. I am a sonographer, which is someone that performs ultrasound exams, and I'm also a supervisor of our cardiovascular labs, which we have across the Puget Sound, going from Bothell all the way to Federal Way. And at these laboratories, we do ultrasound exams of the cardiac and vascular system, and that would include the heart and your arteries and veins and organs and where they get blood supply flow. And so I do ultrasound procedures throughout the day, but at the same time, I also wear a second hat as a supervisor and manage a growing team within our cardiology department. One of the unique things, other than having two hats at the same time and being a provider as a sonographer and then also a supervisor and administrator, is that our department spans medical specialties. So this is an area outside of primary care where you would work with specialists such as cardiologists, pulmonologists, rheumatology, and these are all parts of the healthcare system that involve different aspects of the body and providing care for each one. And so it's very wide-ranging, and my role here at PacMed really varies depending on if I'm with a patient doing an exam or if I'm helping a team member as their supervisor. So it's kind of nice to be on both sides and be able to help and support my team in many ways. And so that's what I do. One of the questions I get asked a lot is, how do you get here? Most people think of healthcare as working with a physician or being with nurses or medical assistants, there's actually a lot more roles. And I didn't know that either until I was in high school and I was job shadowing in a program. And they had asked if students want to go and shadow different roles in a hospital. And I was like, sure, I want to go. I want to see what it's like. So I went and I said, I'd love to be a doctor, but I don't really know what they do. So I was able to follow a pulmonologist, which is a doctor that checks the lungs. And he went from room to room assessing different patients in the hospital. And I thought that was interesting. He got to talk to them a lot. But he really just talked to them and checked in with them. I wanted to see more. I wanted to see if there was something more interesting. So they paired me with the pulmonology nurse. And I thought, okay, that's really cool. I'll follow the nurse. You know, being 16 and in a hospital and sitting in a corner watching them pull tubes out of people in the hospital was just daunting. It was not what I expected. I saw a lot of people really struggling with their health care, and it looked like a very hard job for me to do. And I wasn't very fond of the idea of poking people with needles or pulling tubes out. So I realized this might not be a good role for me to shadow. So, you know, I asked, is there something else that I can shadow? And they said, sure, we have an imaging department. And I thought, okay, I've never really had an X-ray or any images taken of me before. So I went, and they had MR, CT, X-ray, ultrasound, and I thought that was really cool. And I followed someone, and they performed ultrasound exams on patients. And I thought, this is really cool. This person gets to go see a patient and, like a huge puzzle, figure it out. And then they find the problem or make a recommendation, and they provide that to the doctor. They're like at the front, in the front of the patient, working with the patient, helping to figure out what is this mystery. And I thought that that was so interesting. On top of no one was pulling out tubes or any fluids or poking needles in anybody. So I thought, this is really great for me. I'd love to learn more. So I found that there's a school in Seattle, Seattle University, that does diagnostic ultrasound. I applied, got scholarships, went, and loved it. And then I joined the PACMed. It was amazing. They have cardiovascular services that are highly dependent on imaging, and one of them being ultrasound. And it was really great to work in an environment that you can collaborate with doctors and nurses and be a part of a team, but not have to be a doctor. It worked great for me. I loved it. One of the doctors was a mentor for me. I enjoyed it, and I found myself liking how to lead a team and work with a team. So I became interested in getting my master's in healthcare, and I got promoted to supervisor. And so one of the biggest things about being in this role is also asking myself, what keeps me here in healthcare? What keeps me at PACMed? And I got to say, it's multiple things. Not only does PACMed have an amazing environment, the collaboration, the family-like environment with employees, the teamwork, the great benefits, the not having to work weekends or late at night graveyard shifts are some of the major bonuses. And I don't think a lot of kids, especially me when I was 16 years old in high school, knew that there were so many wide-ranging things in healthcare. So I'm very glad that I got to do job shadowing, that I had a mentor, and that I found something that fit me. And so today's presentation and what me and Shante want to share with you is that same kind of drive and initiative. Is we want you to learn a little more about healthcare and different roles in healthcare and how interesting and great it is. Thanks for joining us today.
So we wanted to take you a little bit through some of the positions that are within outpatient healthcare. And of course, this is a small sector. There's probably a wide range of different positions, but we wanted to show that there is possibly a space for you anywhere that you find interest and you find a passion. So let us take you through a normal visit that you would have if you went to the doctor's office for your own health care. And we also want to let you know that it doesn't always involve a patient. Sometimes it involves your own coworkers that you are dealing with on a day-to-day basis. So first, whenever your parents possibly call to schedule an appointment, and or yourself, if you're there at that point, you feel comfortable scheduling your own appointment, you're normally talking to a scheduler. Jolene, you'll want to go back to the slide.
Thank you. Sorry about that.
It's okay. And so the scheduler is somebody that you're talking to on the phone. You're giving them your basic information. They're trying to help coordinate your care to get you to the next step, whether that is an appointment or a message to the doctor in regards to something that you need or you have a question for. And so they're helping you with that particular step. They're picking up the phone and they're gathering all this information, and they're trying to handle and take care of you on the phone while you're there. And if at that point they make an appointment, the next thing that happens is you come to the clinic. And at the clinic, you're going to have some front office people who are, able to check you in. They may be asking you for insurance. They may be asking you your birthday or your identification, just to make sure that we got the right person that we're treating today. And they're saying hello, getting to know your name. I see these people as the people that you see and you build relationships with, truly, because you get to know these people when you come and visit, and they want to know who you are so that they can help facilitate your care if you should ever come back to the clinic. And so they're helping you get checked in, taking your co-payment, and they're also helping with scheduling follow-up appointments while you're on site. And they're also helping if you have a referral and the doctor sends you off for an imaging, which Jolene will talk about later, to get an X-ray or that cardiovascular test or something like that if you have an issue. So say, for instance, you're coming in and you've hurt your arm. You're now going to go to your in-room experience. This is the medical assistant. And so I do want to say that once you get to the medical assistant job, that does require some school. That school it can be a technical college for you to go to. And it's not sometimes a 9-month to a year program where you're getting trained of how to do vitals, which is, blood pressure, checking pulse, that kind of thing, and processing requests and knowing the level of care that you have to deliver to a patient. And so there is some school involved once you get to the medical assistant level. That medical assistant is now going to pull you back to the appointment, and they're going to assess what's going on with you. They're going to ask you some additional questions just to make sure that they have the true reason why you're coming for your appointment that day before you see the doctor. So they're going to ask you, like, what happened? How did you hurt yourself? Was it at school, in gym, on track or something like that? And they're going to really try to pinpoint exactly where it is that's hurting. So when they pass you on to the doctor, they're letting the doctor know why you're there. The next is going to be the consultation. The consultation is normally with the provider or some type of subset of a doctor. That could be an advanced nurse, which does require more schooling. It can be a doctor or a PA, which does require more schooling, that would see you and truly assess the issue. These are the docs that have gone to school to really identify where things are connected within your body and truly pinpoint exactly what's going on with your arm that's hurting. At that point, the doctor is going to send off a referral, and that referral is going to go to some referral coordination people. They're going to check in with your insurance that your parents have that says, hey, this service that we're sending it off for imaging is going to be covered, and the person can be seen at this place. And so at that point, it gets approved. The front office team is probably giving you that information and contacting you probably about a week later or so that they can set up the appointment, or immediately, because if you're hurting that bad, you probably need to get an X-ray really soon or MRI or something like that right now. And now Jolene's going to go over the next part of what happens in a patient's visit.
Yes, so if you have symptoms like your arm is hurting and your doctor's interested in finding out, well, is it sprained? Is it broken? Is there something more significant going on? They're going to want to send you to probably ancillary services. Ancillary services covers a wide range of specialties. So it could be for imaging, it could be for a procedure, maybe a biopsy where they take a piece of tissue and test to see how healthy your body tissue is. It could be a number of things, including physical therapy. If you've been hurt from a sport and you injured your arm, they might think therapy might be the best thing for you. So ancillary services covers a wide range of things that help support a doctor's healthcare plan. In the picture, this is our cardiovascular team. They perform ultrasound exams. So let's say a patient has or you have a hurt arm and it has lots of swelling. And maybe the doctor wants to check if you have a hematoma, which is blood leaking into the muscles that could cause a huge lump. He might send a referral to have an ultrasound of the arm done. So one of these team members in the ancillary services would do an ultrasound to check and see if there's any blood that is pooling within the arm tissues. Or we might send you to X-ray to see if the bone has broken, or maybe to MRI to see if any of the muscle tissues has torn and that has caused your pain. So the staff in ancillary services will do your imaging test, and then they would create a report, and that report will then go to the doctor through medical records team. And that's the next group that you see in the top right-hand corner. This team within medical records ensures that the report is abstracted or copied into your medical chart, which may be an electronic form, that the doctor also receives the report within an EMR, which is an electronic medical record system. And they're also able to make sure that any pictures from the ultrasound or the X-ray or the MRI is easily viewable for the doctor as well. And they would load that into a PACS system, which is a PICS archiving system. And next, the doctor would receive the report and be able to help figure out what's causing your arm pain and what is the next steps for treatment of care. After maybe he prescribes medication or wants to provide you a follow-up appointment, you may go on to the next thing, which is a post-appointment visit. And that would be the last group. Here we have a picture of some of our amazing nurses. And this team would then help follow up, check your arm, make sure you're doing okay, and then find out if you need any other care after that. So in this, we see everybody has a hand in healthcare.
So just to wrap up on this particular grid, because we just want to, since you guys are here wondering about healthcare and whether or not where you fit at and if there's school involved. So let's wrap it up in a nice little neat shell so you guys kind of know. Scheduling, not a lot of school involved. You probably want to do some customer service training so you know how to talk to people, help guide them through with good questions and communication. Check-in is also something that doesn't require schooling, but same thing, some customer service, maybe having a little bit of understanding about some of healthcare terms like rheumatology, some of these fancy words for specialty, and just understanding that. But a lot of times companies actually train you on that when you're when you come on board. Medical assistant for in-room experience has some technical training where you're going to school for, like I said, about 9 months to a year to get your certificate, which is actually nationally recognized. So if you were a medical assistant and you became a nationally certificate medical assistant, you would be able to take your license anywhere within the United States at that point. For the provider, the same thing. They have a long amount of school. They're normally going to school for 8 years. Sometimes if you go into a specialty, you're going to school for 10 years or something like that. But, you know, in the end, same thing. That license, you're able to eventually go to another state that you want to be at. Referrals for our services that are outside of the clinic. Doesn't require any schooling. It's the same kind of thing where you kind of learn on the job. A lot of time they do want some experience where you've either worked at check-in or scheduling, because now you've now you've seen how referral systems work. So that's how that one works. Ancillary services, it all depends on which service you want to go to. And luckily, we're going to have a game later that we're going to go over some of the how much people get paid in these different positions, and you'll be able to see how much some of these ancillary services do get paid to go to school. So ancillary services could be anything from 1 year to 5 years. It all depends on the specialty of the service that you're going into. Medical records, there is no actual training for that. It is similar to growing up in a company, or at least having some understanding of medical history and information like that. So that's normally you're able to be trained within the company. And then post visit, that's the nurses and PAs and things like that. There is some training with that. And nurses have either a 2-year degree or a 4-year degree, or they even go on to get their master's if that's something that they're interested in. So we just wanted to show you that overall in healthcare, there is a way for you to fit in if that is something that you're passionate about and you can see yourself in any of these roles.
So Shante, I just want to call out, we have one question in the chat that you might be able to add to. Aisha asked, are there careers in healthcare that cross with computer science?
Oh my gosh, yes. So that is one of the salaries we're going to go over later. So I hope that, you actually can get this one right about how much they make. So normally for IT engineers, those are the people who are creating applications. And so as Jolene mentioned earlier, she said EMR. That is an electronic medical record. There was some IT nerds in the back that put together that particular application in order for us to house patients' medical records online. So no longer do we have the whole paper chart system. It is an online thing. And that took an IT engineer to create. And so, yes, there are jobs in here for IT, for people to help us be able to make efficiency, for workflows, to make the patient's experience better, also be able to make our staff's experience better about the tools that they use to deliver care. The worst thing we could ever do is lose something where it could affect a patient's outcome. And so IT does help us a lot with making sure that we tidy up any of our requests so that they are findable, discoverable, and that we do not lose track of our patients' needs. So that's a great question. You're welcome. Any other questions? And if not, we're going to move into this game, and we can't wait to see what you guys say.
Yeah, I don't see any questions now, but at the end, we'll definitely be able to answer any that you place into the chat. So we're going to move in, and I don't know if any of you remember, but there was a game called Celebrity Name Game. I absolutely loved it. Thought it was so much fun. But for today, for you guys, we're going to change it to Salary Name Game. So I want you to have your chat ready to go, because we want you to participate and tell us your best guess. So in the Salary Name Game, we're going to show you 2 options. On the left side will be option A, and on the right side will be option B. You'll be able to decide, after we give you a little information, how much that role probably makes. So the first one, name that salary, business office staff. Shante?
And yep, these people are the people that check you in. So these are the people that say hello, thank you for coming to the clinic. How can I help you? How can I assist you? So let us know how much you think this particular position that does not require schooling actually makes.
So option A, 35 to 56,000, or 57 to 100,000. In the chat box, type in A or B. Oh, I see answers rolling in. That's a lot of A's. Great. And the A's have it correct. It is 35 to 56,000. And for someone without a degree that is entry level and joins a clinic as a business office staff member, that's a lot. Great job, guys. Next one, name that salary, medical assistant.
So the medical assistant is the one I said that has a little bit of school. They are either going for 9 months to a year to get their certificate. That's a national certificate once they pass their test. And they're the ones that are helping the patients, get their vitals and assessing the patient's needs. How much do you guys think this person makes?
All right, option A, 32 to 65,000. Option B, 41 to 75,000. I'm checking out the chat. I see lots of A, B, A, B. Ooh, this is a hard one to call out.
Yeah.
Anybody else? Type in A or B.
I'm
the
seeing
B's
a lot.
have it. Medical assistants, they make $41,000 to $75,000. Really prominent role in medical, in healthcare. All right, next one. Name that salary, a nurse.
So our nurses are the ones that are, whether they're in the hospital, they're doing injections that, for like cancer or allergy shots. They're the ones that are triaging patients. They're helping with wound care, all the little things of pulling out the tubes, like Jolene said. She was like, I'm not sure I want to do that. They're the ones that are really hands-on with the patient and then trying to help bridge between the medical assistants and the providers. So how much do you think the nurses actually get when they've gone to school for 2, 4 to 5 years if needed?
Option A, $57,000 to $115,000, or $41,000 to $90,000. Do you think A or B? A, I see lots of A's. You guys are right. $57,000 to $115,000. Gotta add, the more specialized or trained nurse that you are, you will make a lot more because you're going to be responsible for more. You're going to be in the harder departments in a hospital or a clinic and triaging patients with significant symptoms. So they deserve a lot. They do a lot in hospitals. Yeah, great job. Next one, name that salary, physician assistant.
So the physician assistants are one underneath the provider. You could see these people normally helping with prepping for a surgery, they're actually in the hospital helping with surgeries with the main specialty provider. They're going to school from anywhere from 6 years to 8 years in order to get their degree. So tell us what you think these people make.
So option A is $60,000 to $100,000, or option B, $90,000 to $170,000. I see a lot coming in the chat. Oh, you guys are spot on. I got to give this away now. It is B. It is $90,000 to $170,000. Physician assistants sometimes even operate as if they are the doctor, the provider. No one oversees their work like a doctor would oversee medical assistants or nurses. A physician assistant can operate on their own, so they make a lot of money too. Good job, guys. Great guess. Next one, name that salary, nuclear tech. So I'd love to tell you about this one. A nuclear tech is someone that gets a 2-year degree. They're rare, but there are some 4-year degrees where they use a specific medical drug called an isotope that has a nuclear component to it. They inject that into a patient through an IV in their arm, and then they put them under a special camera that takes pictures of the organs and structures in the body, and the camera can visualize the nuclear medicine within the human body. And so what do you think a nuclear tech would make? Option A is $75,000 to $120,000, or B, $82,000 to $110,000. Ooh, this one must be hard. The chat's coming in a little slower. I see a mix of A's and B's. What do you think, Shante?
I'm seeing more A's.
More
I got a couple.
A's?
Yeah,
You guys have it. It's $75,000 to $120,000 because they handle such a specific drug with a bit of radiation and risk to them. They do get paid a lot of money to handle that properly and to monitor patients. Really important job too. Great guess, guys. Next one, name that salary. Practice manager.
That's me. So the practice manager is somebody that works with the providers and also the organization to help usher in new things in the clinic, hire new doctors, and make sure that we are delivering the best care possible and have all the tools that we need in order to deliver good care to patients. So what do you guys think I make?
Option A, $48,000 to $128,000, or option B, $32,000 to $70,000. I want to see you in the chat.
Got a little bit of mix there.
Yeah, it is mixed.
So
it is A. $48,000 to $128,000, and that's a huge range. And that's because you've got a lot of practice managers who are experienced in so many different areas and specialties, and they pretty much know everything, manage everything, do everything. They're so important. They earn the big bucks too. Next one, name that salary. Xray Tech. You might have heard of what Xray is. You would go in and an Xray Tech would take pictures of your body using Xray technology, and it would produce images that show your bones and how well they're structured. How much do you think an Xray Tech would make? Option A is $50,000 to $92,000, and option B is $54,000 to $79,000. I want to see you in the chat.
It's a lot of A's, I see.
I see a lot of A's. You guys got it right. $50,000 to $92,000. Xray, just like nuclear tech, has a little bit of exposure to radiation, and so we need specialized people with special skills that know how to keep everybody safe. So they make good money too. Next one, name that salary. Medical coder.
So our medical coders, they do have some school involved, probably about 1.5 to 2 years. They're the individuals that help with making sure that our providers and our organization are coding correctly based that lines up with the insurance. So that way we don't have any fraud or medical fraud, and we don't get in trouble with the federal government. So they really do play a vital part in making sure that we bill correctly and that we charge correctly. How much do you guys think these people help in this vital role?
Option A, $40,000 to $72,000, or option B, $22,000 to $50,000. I'm checking out the chat. I see lots of A's. You guys are right. $40,000 to $72,000. Good guess. Next one, name that salary. Sonographer, that is me. A sonographer is someone that is trained to perform ultrasound exams. They can have an associate's degree or a bachelor's degree, and they can specialize in multiple different specialties such as cardiac, vascular, or general ultrasound. How much do you think a sonographer makes? Option A, $70,000 to $131,000, or option B, $55,000 to $95,000. I'm looking in the chat. You guys are right. A, $70,000 to $131,000. Another great role in healthcare. Next one, name that salary. Doctor.
So as we talked about before, it really all depends on the kind of doctor. You have your specialists that go to school for quite some time, maybe that's almost 10 years, and then you have your regular primary care providers that maybe go to school for possibly about 8 years. How much do you think the doctors make?
Option A, 200 to 425,000, or B, 150 to 330,000. I see lots of A's. I think we have lots of high hopes. A doctor actually has a salary range of $150 to $330,000, and I gotta tell you, that's a lot of money still. That is a lot.
Definitely. So Connor did ask a question, how though? So Connor, we'll come back to your question a little bit later, right after the game. All right, the next one.
So name that salary, supply chain analyst.
So our supply chain analysts are the individuals that help with making sure that we have the supplies on hand for our patients. So that is Band-Aids, needles, any type of wrapping that's needed, bedding, crutches, anything that we need for the patient. So they're the ones that actually determine and help us determine how much we need in the clinic to serve our patients. So how much do you guys think that this individual needs? How much do you think they make? Sorry.
Option A, 57 to 105,000, or 32 to 75,000.
I got some B's and A. B-A-A, B-B-B.
I see more B's.
Yeah,
You'd be surprised. The answer is A, 57 to 105,000. A supply chain analyst is actually responsible for maybe 1 million different kind of items that is needed in hospitals and clinics, and they have to know what every little thing is and how to order it and get it. Isn't that right, Shantae?
Yep, and they're our purchasing power. They're making sure that we're getting it for the best buck. So
that's a good one. Next one, name that salary, clinic supervisor.
So a clinic supervisor is one normally underneath the manager, and they're the ones that actually run the clinics. And so they're in charge of the staff. They're making sure that the clinic is running smoothly. If there's any doctors that are out, they're making sure that they're communicating with the patients about what's going on. They're helping put the schedule together for the providers and providing coverage for when doctors need vacations or staff need vacations. So how much do you think the clinic supervisor makes?
Option A, 52 to 100,000, or B, 43 to 80,000.
I see A's.
More
see a lot
A's?
of A's. Mm-hmm.
Yeah. The answer is B, 43 to 80,000. Okay, last one. Name that salary. Informatics IT engineer.
So we talked about IT, you guys, earlier, and they're the ones that help make us run efficiently. These individuals can come out of a 4-year degree and be an IT engineer and help manage medical records for us on an application that they've created. So how much do you think these individuals make to create these applications for providers and hospitals to manage patients' care?
Option A, 86 to 254,000, or B, 86 to 120,000. I want to see you in the chat. What do you think it is? Five A's. You guys got it right. $86 to $254,000. And if you have been in Washington for a long time, you know that IT, engineering, computer science. I mean, up the 405 corridors, a lot of major companies that create and hire IT engineers.
So we are at our 5-minute warning. We do have a couple of questions. It looks like somebody had their hand raised. I want to wrap this up real quick because I do want to get to that one question, and we do have you guys do need to sign in saying that you've attended. So overall, we just wanted to make sure that you guys knew that there is opportunities out there for you. Make sure you guys are asking questions of your counselors. Make sure you're talking to people that you know that are in healthcare if you're interested. Try to find out if you can do some shadowing. So ask the questions, you guys. Also, we just want you guys to know that there are people out there that, get into jobs that they don't even know that they like. So make sure you identify what you like, what you don't like, your passions. Like Jolene said before, she figured out she didn't want to pull tubes out of people, but she's okay doing an ultrasound. And that's where she found out that she could fit into healthcare. So find that out too. Make sure you learn the differences between the careers, because as we try to show you, there is so many different careers in healthcare, and I'm pretty sure you can find something that lines up with you. Choose a school or a training program that lines up with what you need and what your path and goals are, and find a mentor, because somebody's going to help you actually tell you exactly about yourself and where you probably need help to go, because it's all about, they'll tell you about the real tea with yourself. So overall, we hope that you really enjoyed this, set your goals, see where you want to be at, and then we're going to get to this one question. Wendy, did we have a question above? Somebody had a hand raised.
Yes, it looks like, I'm not sure, Tygus phone, there's a hand raised. So if you have a question, go ahead and unmute and you can ask your question to Jolene or Shante. I'll also check on the link. You guys say it's not opening, so let me check with Candace on that link.
Okay, and then Connor, you had a question earlier about, you said something in here about how is that? How
at the time of the imaging, either nuclear, sonographer, or X-ray, and someone responded, depends on the specialty. I'm going to agree with that. If you are specialized in a certain field of medicine, you're going to earn more. You're going to get more. If you also get a state or national licensure to practice in that field of medicine, you're going to earn more on top of that. If you double up, just like I am trained in cardiac and vascular, you earn more as you are able to offer more as a provider.
Okay, thank you.
You're welcome.
I hope you guys enjoyed this. Don't forget to try to log into Google Docs. I hope you guys find something that you're interested in and that you're passionate about. So I hope you guys have fun, and thank you for joining our session.